C'est ouvert.
Est-ce que tout le monde est prêt? C'est bon? Alors, bon.
So, hello everyone and welcome to this press conference together for the Public Health Regional Direction of Montreal and the City of Montreal together. This conference is being broadcast as usually on the Facebook page of Santé Montréal, and I would like to start, as we always do, by mentioning to the journalists who are present over the phone to please press the mute button to avoid any feedback. The press conference will start with Dr. Mylène Drouin, who will be speaking in French, followed by the Mayor of Montreal, Ms. Valérie Plante, who will be speaking in French, and after that, Dr. Drouin will be speaking in English, and then Madame Plante will be speaking in English, and the question period will follow, in which we'll ask journalists to ask 2 questions most each, since there are many journalists present on the line. So upon those words, I would like to remind journalists to stay on mute, and I hand over the mic to Mylène Drouin, the Montreal Public Health Executive Director. So hello, everyone. Today, we will take a moment to go over the situation in Montreal. We will, of course, talk about the reopening of certain sectors of economic activity, as well as a few messages on the face covering that is going to be accompanying us over the next few months, over this period of deconfinement or of reopening of certain sectors. As a state of situation for Montreal, we are at 12,437 cases. That's 450 new cases in the past 24 hours. So we can clearly see that we have a certain daily stability in terms of new cases, but that represents the screening criteria that are allowed within the health network. We unfortunately have 1,039 deaths, of which most, 80%, are in CHSLDs and RPAs. 56 new deaths in the past 24 hours. So in the past few days, we have seen a lowering of the new daily death toll for our region, but it does remain very high globally, and I wish to give my condolences to all the loved ones of those families. What is interesting to follow is a lot the new hospitalizations, the new admissions in intensive care. And we have a certain level of stability and have had in the past week, whether it be in terms of hospitalizations, both new hospitalizations and new ICU. That is an encouraging sign. If we look at the epidemic curve, we can still see that certain territories have much more pronounced curves than others. Certain neighborhoods have taken over with high rates compared to others. And there's areas like Montreal Nord, Saint-Michel, Rivière-des-Prairies that clearly have an epidemic curve that is different from all the other neighborhoods. We are very sensitive to this, and we have already started digging into the situation and meeting partners in the field to understand what is happening. I've had a lot of questions on the situations of Montreal Nord, so I will take a bit of time to tell you a little bit of what the situation is and what we want to do about it. So we have 1,053 confirmed cases in that territory. The borough is in first position in terms of rate per 100,000 inhabitants, a progression that appeared around the 8th of April in a more pronounced way. So clearly it's not associated to the first wave that was really linked to travelers or imported cases. So probably, and in our hypotheses, it is clearly that there's a part that is really explained by the outbreaks in CHSLDs, but also the fact that we have healthcare workers in that neighborhood. So 23% of cases are linked to healthcare workers, whereas in the other neighborhoods, it's more around the 15% mark. And if we look at the outbreaks plus the healthcare workers, it represents over 40% of the cases over those territories. So it's also territories that are proportionally much younger than what we can see in the rest of the island of Montreal. If we look as well at the distribution of cases, we also have a few outbreaks in work areas where we are intervening proactively, and we have not succeeded in identifying specific zones of outbreaks or community transmissions. It remains that in the context where we wish to stabilize community transmission and be sure that we truly are in control, particularly for reopened sectors, we are working with the partners of the borough and the community sector to reinforce certain strategies, either in link with social distancing, of course, the occupation of the public space, compliance in the places of work to the recommendation, everything that has to do with the multiplexes. And we're also looking at a strategy to reintegrate screening over the next few days at the community level for people who are asymptomatic, probably, but also maybe to go and have a look, even in certain neighborhoods, if there is not a community transmission that would be sustained. That screening, you will see I'm going to talk more about reopening and deconfinement. We're going to have to slowly be part of our strategy to test more, not just in hot areas, but over the entire island. So to talk a little bit about the entire strategy of what we call deconfinement, but especially reopening of certain sectors, we have been working now for a few weeks already, having a look at the conditions that would be necessary for what we call a safe and successful deconfinement. So a safe deconfinement is one that will not bring us to a second wave, and that will, of course, reduce the serious cases that require hospitalizations and ICU care. And also an aspect of a successful deconfinement is something done intelligently, progressively, that will allow us to control the outbreaks and to make it that we're not going to need to come back and reconfine, and that will be able to allow people to go back to some kind of normalcy, whether socially speaking or economically speaking. The metropolitan area was very affected and is still affected hard. And we have specificities here that make it that we have to adapt our deconfinement strategy progressively. First, we are the epicenter, so that means that the virus circulates here more than anywhere else. And of course, we have a very important volume of cases and contacts that we have to investigate. It's an important logistical challenge. We have more eclosions because of the size of our workplaces. There's a strong density, so in housing or sometimes in places where distancing is difficult. Strong mobility of the population, including everything having to do with public transportation, light rail trains, and of course vulnerable populations for whom sometimes it is difficult or even impossible to respect the rules of social distancing. It is pretty clear, internationally speaking, the measures and the conditions that are necessary for successful deconfinement. The question we're asking ourselves today is, does Montreal meet those conditions, and what do we have to do quickly over the next 3 weeks to ensure that these conditions are set up? The first criteria is that the transmission of the virus be under control or mastered. As I was mentioning, there are certain neighborhoods that worry us particularly, and we are quickly going to be looking for information in order to see whether we are in a community sustained transmission that is more significant, or whether it is more outbreaks in closed areas for which we could manage to control everything. The second condition, of course, is our healthcare system and the ability to treat, isolate, and respond to the needs of people that need to be hospitalized or have intensive care treatment. Of course, with the crisis that we're experiencing in CHSLDs, establishments right now are already thinking and preparing themselves to start certain activities again, but also ensure that they can find their initial capacity to be able to face a possible surge in hospitalizations and demand due to the reopening of certain sectors. The third condition, obviously, is that the public health system be able to also have the ability to face an increase of cases and contacts to follow, but also be able to detect the outbreaks and intervene quickly in order to control them. And in that sense, of course, we are going to, as I was saying before, we're going to be progressively reintegrating in sectors, but also the entire island, a strategy that will be able to bring us to test the entire population at large, to be able to detect these eclosions. And the other element that we're working on is a little bit what we call our prevention brigadiers. That is, frontline people who are going to support those areas that have to reopen in different sectors in order to ensure that the preventive measures are set up and to give them the necessary tools to avoid any outbreak or cases. Of course, we also have to make sure that we have good choice in where we choose to reopen. And the last condition, of course, is the commitment of the population to also follow this great adventure, which is the reopening of the different environments. So we can see clearly that the health network has its share of work to do, the public healthcare system as well, businesses are getting ready, but I think that the population also must do its share and not stop with the guidelines. I know it's spring and we feel like socializing more and again, but clearly we have to maintain vigilance. Which brings me to talk about the face covering. The Premier, as well as Dr. Arruda, gave us recommendations last week. They recommend using face coverings in public places when the 2 meters is difficult to respect. Knowing and with the evolution of knowledge and knowing that we have asymptomatic people who could transmit the virus, it is an additional protective measure that is complementary to those that we already know, such as washing hands, obviously, and the 2-meter distance, which remains the basic measure to respect. In an urban context, with all the characteristics that I named, it is clear that for us, face coverings must remain a social norm. And we encourage, and I ask the population, when you are in stores, when you are in public places where social distancing is more difficult, in public transportation, and also when work environments reopen and that it will be difficult to respect the 2 meters at all times, we recommend very strongly, and we ask you, in fact, to use a face covering, and certain indications will have been given to be able to make them yourself, and the mayor will also be able to talk to you about other initiatives to make it more easily accessible. It is therefore with that in mind that we are working on the progressive reopening strategy of different sectors of activity with all the particularities that Montreal has. Of course, we're working with the parameters that have been established by the provincial government, but also we have to adapt them to the Montreal reality. And of course, in order to be able to get to that, we need the collaboration of all Montrealers to be able to have success in this operation. I also understand that we are going through a period of great changes, great uncertainty. We must adapt ourselves, and even, as we've said, the knowledge is evolving very quickly, which brings us sometimes to, change certain recommendations and having to adjust them. However, I know that this makes things difficult in a daily basis. I mean, I, as a citizen, as a mother, I clearly see that there's a lot of questions. There's a lot of people considering things with the reopening of schools, and we are really going to try to make sure that Montreal is ready and fills all conditions in order to avoid, of course, a second wave and a normal, more or less normal life through this COVID pandemic. So I thank you, and I think that it is together that we'll get there. Yes, absolutely. Thank you, Dr. Drouin. I will specific attention has to be given to the metropolitan area. At the same time, I do wish to reiterate that our priority is the health of the population. That is the reason why we are following the guidelines of public health to the letter, and we're working to set everything up to allow the reopening of construction sites, manufacturing activities, and neighborhood stores, and that in a safe way. We are therefore going to be working together with companies in this transmission over the course of the next few weeks, of course. If the epidemiology situation should change, or if we were not able to ensure the winning conditions to this reopening, we will be adjusting ourselves using the guidelines of public health authorities and the government. Now, as Dr. Drouin was saying so well, the beautiful weather is on its way, and like anybody else, it's nice. It's nice to have sun. It's good for your heart. It's good for your soul. It's good for your body. And so it is very tempting to take advantage of it. So I wish to, right now, remind you of certain rules, as Dr. Drouin has said. In prediction, for example, of the weekend, that is probably going to be very beautiful. I ask the population to not have any gatherings. It's very important that guideline remains. As well, when you go to the parks and you go to your neighborhood parks, by what that I mean, go to the parks that are close to where you live. You don't go through the city to get to another park. So before you leave your house, and when you come back, you wash your hands, and of course, you keep 2 meters away from other people as much as possible. And that is where the reality of city life comes in, because it's very dense. So that has an impact on our ability to respect the 2 meters, and that's something that I hear a lot. People say, Madame Plante, we do everything we can. We really are trying to respect the rule, but it's not always easy, and we get it. So that is why the extra measure, which is the face covering, is pertinent. Dr. Drouin has hers, and I have mine as well. I would invite the population that wishes to make themselves one to go to the website of the Quebec government. They will explain to you how to have a model without seams and one with seams for those who would wish to do that. And also, why I'm mentioning this to you, it's because it's useless to go into the pharmacies. It's possible that they may have masks, but it's very possible that they won't. So I would really invite you to go visit the Quebec government site to see what your different options are. This being said, the notion of leaving nobody behind is very important for us at the City of Montreal. So we have decided to give access to face coverings to the most vulnerable populations. So we will be distributing reusable face coverings to many different organizations on the territory of the City of Montreal over the course of the next few days, as quickly as possible, in order to make sure that this distribution be done. So, once again, I wish to remind you, the face covering, when you put it on, it doesn't mean that you can gather. That is absolutely not the message that we are giving. The face covering is an extra measure when it is difficult to keep the 2 meter distance with other people, whether it be when you go for your daily walk or when you go do your groceries. Same thing, for people who do their daily walk, it can be walking, but it can be on the bike. So I would invite people, regardless of the way that you will be, going out for fresh air, if the 2 meters is difficult to respect, I would invite you to wear a face covering. And finally, what I wanted to say as well is that all of our teams at the City of Montreal have been working very hard to present in the next few weeks a plan, I would say that is a summer plan, what the city might look like in order to ease moving around safely, trying to respect as much as possible this social distancing, which is so important, while taking advantage of the summer, because the summer is coming, and for many of us, we might stay in town this summer if we have to limit moving around. So we are working to make sure that the city continues to be a pleasant way, despite the fact that our festivals won't be there, or our large gatherings that we had gotten so used to during the summer period in Montreal. So to end with, I really wish to say that, of course, these are changes in our habits. Since the beginning of the crisis, Montrealers have shown a lot of resilience, a lot of discipline, and I would really ask you to continue doing so in order for us to, as quickly as possible and as well as possible, be able to get through this situation that is very demanding for everyone. So I thank you for your attention. English now.
I will do a little update on the Montreal situation and talk about the strategy, the reopening strategy for Montreal of certain sector of activity. So as for today, we have 12,487 cases confirmed in Montreal. It is 563 new cases in the last 24 hours, more than 1,000 deaths, most of them, 80% of them in the context of CHSLD and residency for elders. When we're looking at the new hospitalization and in intensive care unit, we see a stabilization or a plateau since last week. This is quite a positive indicator for us. But what we see also is that certain neighborhoods have an increase in the number of cases that is more pronounced than other neighborhoods in the last weeks. We see in Montreal Nord, Saint-Michel, and Rivière-des-Prairies. So we had a lot of questions about Montreal Nord in the last weeks. So I will do a little update on what we are seeing and what we are working with the people in this neighborhood. So as for today, we have more than 1,153 cases confirmed. It is the neighborhood with the most, the higher rates. It is a progression that we've seen since the 8th of April, and more than 40% of the cases are associated with CHSLD, RPA, the outbreaks in those places, or healthcare workers. And we have a higher proportion of healthcare workers. That 23% of the cases are healthcare workers, and we see in other neighborhoods that it is quite less. It is around 15%. And the cases are, we have more cases in the adult population. We also have some outbreaks in this neighborhood, but in workplace, in which we are having interventions, and we have not seen specific outbreaks in specific neighborhoods in Montreal Nord or in specific buildings. We're working with the arrondissement and with the community partners to reinforce some strategy, to make sure that distanciation is well applied, to make sure that workplace have all the tools to apply the recommendations. And we're looking at a strategy to screen specific, to have a specific screening strategy in this neighborhood in the next days. I wanted also to talk about the Montreal strategy for the confinements or to reopen certain sector of activity. What we want from Montreal is that we reopen in a secure manner and that we have a success in the reopening, so we do not have to close again. And Montreal has specific characteristics that we have to consider. We have a high density of population. Of course, we have public transportation that that poses an issue, and vulnerable population that we have to consider in our strategy. And so we're working with the government's orientation to make sure that conditions that have been well documented in the literature are in place. So we have to make sure that the transmission is well controlled. That's what we're going to do in certain neighborhoods where we have a suspicion of maybe a sustained transmission of the virus. We have to make sure that our healthcare system regains its capacity. We have to make sure that our public health system is able to manage an increase in cases if we open a certain sector, and we have the capacity to intervene when there are outbreaks. Of course, we have to make sure that the workplace that are going to reopen have the capacity to put in place the measures and the recommendations that we are going to put. And of course, we need that the population be engaged in maintaining the distanciation, the 2-meter distance, in maintaining, of course, all the recommendations around gatherings. And the new recommendation that we have is the couvre-visage, I don't know in English.
Face covering.
Face covering. That is not the same thing as a mask that we have in the healthcare facilities. And this is a recommendation that the government launched last week, or with knowing that with new, knowing that asymptomatic person may, we have a certain percentage of the population that can be asymptomatic and that can spread the virus. It is a complementary measure to other measures that we know of, washing your hands and keeping your 2 meters. But we think that at a population level, we should wear those masks in public places in Montreal, knowing the density of the population and the increased risk that we have in our urban region. So we ask the population to wear them when you know that it is going to be difficult to respect the 2 meters in public transportation, at the grocery or pharmacy, and of course in workplaces if you know that the 2 meter is going to be difficult to respect. So I want to say that we know that it has been now more than 8 weeks that we're in this pandemic in Montreal. We know that it is hard. We have to adjust ourselves. The spring is coming, so we want to go out and socialize a little bit more. But we have to do the things really well to make sure that we do not have to reconfine in a couple of weeks. So we really ask, and we think that it is together that we're going to have success in our strategy of deconfinement. Thank you.
Thank you, Dr. Drouin. And on my side, I definitely want to speak to you about the gradual economic recovery plan announced by the government of Quebec earlier today, and the current situation here in Montreal. So first of all, I am pleased that the government of Quebec and the public health authorities have found a good balance between reopening schools and certain economic activities for the metropolitan area and for the rest of Quebec. At the same time, I would like to reiterate that our priority is definitely the population's health. So we want to make sure that everything is put together nicely in an order to make sure that all those places or the working environment are safe. So if the epidemiological, that's a difficult word to say, situation changes, or if we are unable to ensure successful conditions for this recovery, we will adjust according to public health and government guidelines. That is very important to keep in mind. As well, as Dr. Drouin just mentioned, the beautiful weather is right outside, and a bit of sun is good for the heart, it's good for the soul, it's good for the body. So I can definitely understand why people will feel the need to go out and enjoy a bit of that beautiful sun. That being said, it is very important to keep in mind a recommendation that has made it so successful for us since the beginning. So I want to thank everybody for being so disciplined. So those rules are not to do any gatherings. The public health authorities and the government has been very clear, and I want to reiterate that. It's no time for any kinds of gatherings. If you are going outside and want to go to a park, I invite you to go to a local one. No time to go on the other side of the city to visit a new park. And of course, to keep the 2 meters distance. And I know that even though a lot of you, most of you are trying really hard to keep that distance, it is not always easy. And this is why we've seen in many boroughs some corridors to support businesses while people have to walk by. So this is where I want to put emphasis emphasis on what Dr. Drouin has just said around the face covering, and has an additional measure to use, especially when you know that it's going to be difficult to keep the 2 meters distance. Whatever you're going for a walk or a bike ride, or you're going to the grocery or the pharmacy, or taking public transport, I definitely invite you to add the face covering as one of the way to protect yourself, but also protect the others. I have my mask right here that I keep, closely if I need to use it, and you can always go on the government website that will share with you some of the ways to do one by yourself, one that you need to sew, and one without all the sewing abilities. So I just want to mention that even though we're inviting you very strongly to use the face covering, it doesn't mean that once you have it on you that you can be with other people. That is not the point. It's really an additional measures that we want to bring out there, so people get used to wear it in places where it's very hard to keep the distanciation. Also, as you know, I'm always concerned about how making sure that there's no gaps or differences between people. And so we will be offering free reusable face covering to the most vulnerable here in Montreal. So we will be distributing them through community organization to the people that needs them. So there will be no gap in there as well. Finally, I just want to say that we are working really hard at the city to come up with a plan for the summer. The sun will be out there. There will be a need to enjoy the summer, though it will be such a very different summer, not having necessarily all the festivals and all the gatherings. So we're looking at all the areas, and that includes also the public space, on how to make it more accessible for both pedestrians and cyclists as well. We'll be sharing, of course, more of those in the next coming days and weeks as decisions are being taken in collaboration, always in collaboration with the public health authorities. So my last message is from all Montrealers. You've been amazing for now, respecting all the recommendations, and I invite you, though some of the economic sectors opening up, to keep on doing what you've been doing so well so far, and maybe to add the face covering if you feel like that would be something that you might need to use in some circumstances. Thank you.
Merci, Madame la Mairesse.
Thank you, Madam Mayor. Dr. Drouin. This puts an end to this press conference. We are now going to start with the question period. I would like to remind journalists to please keep their telephone on mute if they're not speaking. And we would ask you to please no more than 2 questions each. If you ask more, we'll penalize your colleagues. Let's start with the questions in French.
Jeanne Corriveau du Devoir. Madame Corriveau, la parole est à vous.
Hello, Dr. Drouin. I'd like to get back to the numbers for Montreal North. You talked about 23%, I think, is a proportion of workers in CHSLDs. Is that the case? No. How many cases in CHSLDs more specifically for Montreal North? Okay, I don't know if the numbers that I have, I don't know if it's today or yesterday. But yesterday we had 253 healthcare workers, which represented 23% of all cases. And we had over 210 or so cases in residences, CHSLDs, residences for the elderly. So globally, but that was yesterday, it represented around 40% of all cases that were tied to healthcare workers and outbreaks in care establishments. Is it possible that certain areas like Montreal Nord or others, that the deconfinement be done later, at different moments? Well, deconfinement, we still have a few weeks. The Premier clearly said that the conditions have to be good, things have to remain stable, and the first condition is the transmission that needs to be mastered. And that is why we quickly want to go see What is going on there? Is there sustained community transmission that we're having a difficult time capturing because of the screening tests that we've put more on healthcare establishments? That's what we want to go see. And of course, within 3 weeks, many things can change depending on the epidemiological situation, but also the ability of different environments to set up the recommendations. And that is everything that we have to work together with this. But yes, there are things that may have to be modulated, but not just here. It can be, schools. It can be certain workplaces. There can be a more sustained accompaniment that can be necessary in certain areas so that the stores or work environments can reopen. And it is this modeling that we have to try to set up correctly.
Dr. Drouin, Montreal Nord
is now the borough where there are the most cases proportionally to the population, which worries the population. A screening test for that area is being asked. If that's not possible, what actions will you be taking in that borough? Well, it's what I said earlier on. We are looking at a series of actions having to do with the population to make sure that the distancing is there, the stores to make sure that they have the means and that they have the measures taken, probably the parks, the public spaces with the borough, that's all being studied, as well as the screening strategy, which is clearly one of the aspects that we wish to set up in the next few days. Is that going to be through a center? Is it going to be targeted? That is what we're going to look at and that we're going to be able to announce to the population in the upcoming days. And I'm saying it in a midterm perspective. We want for the screening, populationally speaking, that asymptomatic people will be able to come back to the agenda when the capacity gets increased. And on that, last week we had a few issues, but it is being reestablished, and the screening in our clinics has gone very well for the past 2 weeks. So I think that by prioritizing certain sectors, we'll be able to take up that screening again.
Maintenant, on passe la parole à la journaliste Kathleen Lévesque de la presse. Madame Lévesque, la parole est à vous.
Oui, bonjour, Dr. Drouin.
Hello, Dr. Drouin. Talking about Saint-Michel et Montréal-Nord, you're talking about modulating, orchestrating things properly. You're talking about screening. But concretely, this week, where will there be screening tests set up? If so, how many of these screening tests do you want to be able to conduct? Are we talking about thousands of tests? This morning, my team was with the people of the borough to think about that strategy. I have a protocol of sampling that is being proposed to me, but it will be many hundreds, and it may be over a period of many days. But we are looking at what the best methodology would be to go get asymptomatic people, but also to target certain neighborhoods. So we are developing that methodology. I do not know whether it's going to be 300, 1,000, 1,500. I don't know. It will be done over a few days. And my wish and what our team is working on is that it be deployed in the next days. So we should have something. There already is a capacity on the premises, but now it has to be orchestrated to be able to target certain areas correctly and being able to have a quick idea, a portrait of the situation. Madame Plante, please. You're talking about a summer plan over the course of the next few weeks. Is that to say that you believe that day camps may be reopened? The parks, the games in the parks for children? Inaudible? Yes, thank you for your questions. It does involve a lot of elements, the ones that you have just mentioned, for example. Obviously, all of these decisions are taken in collaboration with public health and as the portrait of the situation evolves. as well. So we are preparing different scenarios, but yes, they have to do with the day camps and the playgrounds. But it does also have to do with the public spaces at large. There's the parks, but there's also certain opportunities of perhaps, for example, making certain areas for pedestrians, taking into account that there's fewer cars. This could be an interesting and pertinent way of looking at things. So we really are looking at all possibilities to first inform the population correctly of what the summer is going to look like, but also give people possibilities of taking advantage of the city despite everything, despite the fact that we won't have everything that we're used to having.
Philosophe du 98.5 FM qui s'adresse probablement à Madame Plante et à Dr. Drouin. Que pensez-vous du retour en classe?
What do you think of the back to school of young Montrealers that is going to be in 3 weeks, Dr. Drouin? I think that we have a lot of work ahead of us. That's what I think about it. Clearly, as I was saying, I named you a few characteristics of the city of Montreal that make it that, whether it be public transportation, etc., the density of the population that brings us to prepare ourselves and to take into account these characteristics in our preparation. I think that schools also have challenges with density, with setting up prevention measures, and of course everything having to do with cultures, language barriers, understanding the guidelines, the entire part of food safety as well. So there's a series of issues, and we are working, of course, with the school boards, basing ourselves on the guidelines to see what it is that we can set up to ensure the safety and to make sure that back to school is safe. We'll see whether things have to be modulated, taking into account the urban characteristics that also affect the school system. And as an extra bit of information, I'm not an expert, so I trust the government of Quebec in the decisions that they've taken. However, as the manager of a great municipality, we, of course, work at accompanying the students. I'm thinking, for example, the public domain, the sidewalks, intersections. We're talking about the people who help people cross. This is under the city of Montreal, the brigadiers. So we are trying to set up the conditions so that it works. But having those numerous questions coming in our inbox for the mayor, I think many parents have questions. And things should become clearer over the next few days from the part of the government of Quebec.
La parole au journaliste Benoît Chapdelaine de Radio-Canada. Monsieur Chapdelaine, la parole est à vous.
Oui. Oui, bonjour, Dr. Drouin. Peut-être.
Dr. Drouin, perhaps explain to us what is so specific in Montreal Nord. According to your hypotheses, I understand that you're trying to see and understand what has happened. But in your opinion, do you have any specific hypotheses that you're exploring? Well, we believe that there are multifactorial elements. The first hypothesis is that there's a lot of workers in Montreal now that were part of the essential workforce in the health network, but I also didn't talk about people who work in the food sector, the services of food processing as well. We can see clearly that there's a few outbreaks that we've seen in specific sectors, and probably there are workers as well who come from those neighborhoods. So my first hypothesis is really as far as the workers and outbreaks either in their places of work that is reflected in our data. The second element is also issues of capacity in maintaining social distancing. We know that there's an important urban density here. There are fewer parks. And the streets, sometimes it's difficult in certain businesses to respect the social distancing measures. So as far as we are concerned, it's multifactorial, but it is explained and it has to be worked on with many strategies to allow people to bring down the curve, which unfortunately stands out compared to other neighborhoods. A question from Madame Plante. You talked about nonprofit organizations that were going to get masks. Can you tell us how many and as of when? We're trying a lot to make a distinction between masks and face coverings. So what we are going to be distributing are face coverings, not masks. And we made a first order of 50,000 face coverings. As I said, that will be reusable so they can be cleaned. These are not going to be thrown away, and they should arrive in the next few days. We are, many of us, making orders of face coverings right now, but we have a good amount of hope that it will be done quickly, and we will be adjusting ourselves depending on the demand as well. Because for us, it really is a priority that nobody be left behind in the management of the pandemic.
De la part de la journaliste Ruby Pratka des Nouvelles Saint-Laurent, qui s'adresse à vous deux. Je voulais savoir si
I would like to know whether, taking into account the fact that primary schools are opening, municipal day camps are still being planned. If so, under what conditions? I believe that the entire question of day camps is being considered at the provincial level right now. There are day camps, there's vacation camps. That's also part of a context where more people are going to be going back to work. Measures to be set up to allow children to be, occupied during the day. So the guidelines have not yet been announced. There will be a possibility of opening them, but clearly it will not look like our usual day camps. So there will be very strict guidelines, but that will come from the provincial level.
Question maintenant de la part de Jean-Sébastien Cloutier du Téléjournal de Radio-Canada. Monsieur Cloutier, la parole est à vous. Alors, je vais la poser pour Monsieur Cloutier.
I will ask a question for Mr. Cloutier. First, Madame Plante, what do you think of the Oh, are you there?
Êtes-vous là, Jean-Sébastien?
Are you there, Jean-Sébastien? No? All right. So what do you think of the deconfinement strategies as far as schools and businesses are concerned, with Montreal happening a week later? Well, listen, last week I had emitted a wish that it be done pretty much at the same time, and I think that on that, 1 week away, I think is quite a good idea with the data that comes from public health. I think that it was the right thing to do. So, of course, as I was saying, although certain economic sectors are opening, our priority remains public health, and we will be following the work of public health very closely in order to see whether any adjustments have to be brought. Second question. Madame Plante, could you give us an indication on the moment where you would wish to open places like, sports areas, libraries, parks? I know everybody's looking forward to it, but it's too early to say anything about it. As I was saying, all of this is part of the different measures that are evaluated as new rules or governmental measures and public health measures are set up. We will be able to share that information. I would say it shouldn't take too long, but I can unfortunately not say anything about it right now because, once again, we're talking about the opening of certain sectors of activity, but we're not talking about the deconfinement of population at large. Hello, thank you. My question is more for Dr. Drouin. The emergencies, which at the beginning of the pandemic, many emergency wards were a little deserted, taking into account what was going on in public health. Today we're starting to see that there's an increase in the numbers in emergency wards, like at the hospital Maisonneuve-Rosemont and Notre-Dame, that are starting to work at full capacity. Is this a phenomena that makes you fear that perhaps there may be some sort of bottleneck over the next few weeks? And what would this mean might bring us problems during this pandemic? Well, I think that the data that we had for new admissions was that there was a slight increase or even a certain level of stability in the past week. So in this case, there were even transfers of ambulances from one emergency ward to another. So it's a new phenomenon in the past 24 48 hours, perhaps the last few days, clearly. So we have to see, is it, are these people who had needs of non-COVID related health services? It's all of that we have to rework together with the healthcare establishments, how we put back certain sectors of the health sector in service, the ones that were left aside to leave room for COVID-related illnesses, because there are people waiting for services. And we're going to have to analyze this data more in detail to see exactly what's going on, but it is not COVID-19 related increases in admissions. There's probably something being reflected on people who had needed services, who perhaps waited, and who are now going to the emergency ward. But we're going to have extra analysis for this.
Zachary Boudreau du journal Métro qui est aussi au téléphone. Monsieur Boudreau, la parole est à vous. Alors, je vais poser la question pour lui.
I will ask a question for him. Mr. Boudreau wishes to know the Federation of Renters, Tenants for Low-Income Housing wants to have data to tenants for these HLMs for the elderly of Montreal and others concerning the number of cases of COVID-19 that public health authorities have about these. Is this an option that is being considered? The guideline and the operation that we made for all multiplexes, including everything that has to do low-rent housing, is an operation to increase the hygiene measures in common areas, the restrictions of visitors, etc. We had committed ourselves, amongst other things, to give the owners the information not on who and how many, but when there were cases, to bring them to be more vigilant. It is clear that in a context where this data is confidential, we're very prudent in our strategies. It has to have an added value, revealing that there's 1, 2, or 3 people in a building infected. The added value that we saw was for the owners to bring them to increase the measures. And if they are being respected, we're not in places where there's one person giving care in different apartments like we have sometimes in residences for the elderly or CHSLDs, we judge that there isn't necessarily any added value if you know that you have 2 neighbors who have COVID-19. We believe that if the general measures are increased and that people respect the guidelines of not visiting one another, not visiting their neighbors, not inviting people to their homes, that people are well protected anyway. Is the Montreal Public Health Authorities thinking about making the usage of masks mandatory for the users of public transportation in Montreal? Okay, face coverings are very strongly recommended. I am asking people to wear them in public transportation and in any other place where you judge, a public place where you judge that the 2 meters is more difficult to respect. We are not thinking making it mandatory. Making it mandatory also brings perverse effects or negative effects. It makes it, amongst other things, that certain populations that perhaps don't have the ability to get them might be marginalized or penalized. And of course, there's also everything having to do with the fact that we don't want to go into an element, of control of fines. We believe that globally the population has respected the guidelines very well up until now, so we're going more with an idea of changing social norms and standards and making it accessible, thanks, amongst other things, to the city, to make it that it becomes a new practice. But we're not in a spirit of coerciveness right now. A question that we just got from Danny Brown. Madam Mayor, what is the impact of the pandemic on the operations of street cleaning in Montreal? Well, of course, the cleaning operations are starting a month later because usually we start cleaning all the streets on the 1st of April. And taking into account the request of the government of Quebec, the date of the 4th of May, we decided to push things back by a month. You know, the alternates in parking. It will be effective as of 1st of May, so the operations will become more intense as of the 1st of May. I do wish to say that it wasn't completely stopped. We were able to clean the main arteries, some bike paths, and but the most of the work is going to be done once the parking alternates will be in effect as of the 1st of May. 2 more questions in French, and then we'll be going to the English questions. So, Elsa, for Dr. Drouin. Dr. Drouin, why is the mortality rate in Montreal, why is it 4 times higher, or 4 times that of Toronto? It's much higher than that of the rest of Quebec as well. I think that there are many, that question's been asked many times. There are many hypotheses. I think that we're going to have a fair portrait at the end of it all. First, of course, Montreal experienced the wave linked to travelers, so importing cases from the spring break, and probably as well from the United States, New York. Toronto started their confining before the March break, the spring break. That's the first explanation. Secondly, of course, with this spring break, there were probably certain healthcare workers who introduced the virus in establishments, and that explains, amongst other things, certain of the outbreaks that were important surges in Quebec. Although I would be surprised to see the evolution, and I would be curious to see the numbers in the end of Ontario, amongst other places. And, of course, is the entire surveillance system, where we have to see whether we're comparing apples with apples. You know, we know that during heat waves, Montreal always has a surveillance system that is very specific. So we always have the impression that we have more deaths. But basically, if you don't count things the same way, well, it's possible that it is reflected in the total numbers. Those would be my first hypotheses. Last French question. What are the reasons that explain the 7-day postponement of retail stores in the Montreal metropolitan area compared to others? What are the benefits from a health point of view? Perhaps I don't have the answer on the 7 days. I mean, it could have been 14, it could have been 6, 8, but I believe that clearly in the conditions that I named to you that are essential, of which the first is linked to the controlled and master transmission of the virus, clearly we don't at all have the same situation, epidemiologically speaking, as in Rimouski, where I believe they had 35 cases in the entire Bas-Saint-Laurent area. So we're not at all in the same situation, and we must therefore be a lot more prudent and particularly must better prepare it because the virus is circulating. English questions now.
Les journalistes anglophones présents sur la ligne de leur patience. On va débuter par Matt Damour de CBC. Matt, you can ask your questions.
Perfect. Thank you very much. The first question is for you, Dr. Drouin. We've spoken about Montreal North, and you've mentioned the fact that testing is going to be increased, but we've spoken to community groups that are very concerned about the idea of deconfinement in that area, and they're suggesting, among other things, things like health corridors, like the ones that have been established in other boroughs. Is the city, is public health looking at the possibility of doing something like that? And you mentioned it in French, but can you tell us about the possibility of staggering the deconfinement in Montreal North?
Staggering?
Stagner, ça?
Okay. We're currently working with the borough and the community groups to look at multiple strategy, including the public places and the corridors or parks, working with the community also to make sure that all groups respect the 2-meter distance, maybe some operation in some specific part of the neighborhood for blocks that we can have more cases in to make sure that the hygiene is increased, and screening strategy is part of all the big strategy that we're putting in place. When we're going to see the numbers and if it is really there is community transmission increase, we'll see if we have to have modulation in the reopening of some sector of activities. At the same time, we do not want there are consequences also of not or reopening some sectors in some neighborhoods, and in other neighborhoods we're going to have people displacing themselves. So we have to look at all those considerations. But first, we have to have a better portrait of the situation.
And my second question is for you, Dr. Drouin, and also Madame Plante. People are still scratching their heads trying to figure out how the reopening of schools and the reopening of the economy, even a week later, is going to affect Montreal. Personally, how safe do you feel it is for schools and businesses to be reopening in Montreal, given the particular situation in the city?
I'm going to scratch my head. I think it is more complex to reopen businesses, but also schools in Montreal for all the consideration that I said, and the particularity that we have with public transportation, with the space, the streets, the public spaces. In school, we have specific characteristics, and we're working with the Commission Scolaire to look at how it can be possible to reopen in 3 weeks. And we'll see with the work we're doing if we have to do some modulation or how we can adjust ourselves to make sure that we respect the recommendation, the government's recommendation, but at the same time we do not put our population at risk. So we have 3 weeks to work on those conditions and to readjust if necessary.
Thank you. Question maintenant de Michel Lalonde de Gazette. Dr. Drouin, can you explain the public health strategy for testing in the region?
In the region?
Dans la grande région de Montréal.
Actually, the strategy was with priority to healthcare sector, CHSLD, RPA, and essential workers. That's what we were doing because of the capacity, the testing capacity that we had. Knowing that we're going to have an increased capacity in the next weeks, we're looking at reintroducing testing of the general population, what we had at the beginning of the pandemic. And to reintroduce those strategy, we're going to focus first on neighborhoods that have higher rates, but what we want in the next weeks is to have a strategy that will be in each neighborhood. People should have access and a capacity to get tested. We'll see what is our capacity and how we manage to make sure that it is accessible to people that have symptoms.
Et en ce sens, deuxième question de Madame Lalonde, will the priorities for testing remain the same now that schools are expected to reopen and some businesses will be reopening as well?
At this time, I think they're going to change. We have to, because one of the conditions for a successful deconfinement is to be able to intervene rapidly where we have outbreaks. But if we want to see where are the outbreaks, we have to have some tests. So this is what we're working with the provincial government, but we're going to adapt the strategy to Montreal because we have a specific particularity.
Okay. Matt Grillos, CTV News, you can ask your questions.
Yes, a question for the mayor. You mentioned the summer plan strategy for the summer. We've seen, in the last weekends when it's really warm outside, there's a lot of people out. Police are giving a lot of tickets. What's this plan in the summer going to look like, and what's really the goal of putting it in place?
Well, it is too early for me to say what will be in that plan because it affects so many areas. It could be about the daycare or summer camp, pools, libraries, parks, public space, or streets. It covers a lot, but the idea is to find a balance between asking Montrealers to follow the recommendation of the 2 meters and not to gather, unless there's a different, something differently being said by the public health authority and government. But we feel like we're going to have to respect those rules for a very long time. So the balance between that while enjoying our city during summer. So, it really impacts our day-to-day life. And so we need to think about that. And that is one of the reasons why Dr. Drouin and myself today wanted to talk about the face covering a little bit more, because we feel that it will be another supplementary tool to keep our a complementary measure to all the other ones, because we live in the city and there's a lot of people.
Question de la part de Marion Scott.
Oh, I think they had they didn't do their secondary. Am I right?
Yeah, just one more question for Dr. Drouin. Thank you. I just was wondering what Dr. Drouin thinks of this deconfinement plan by Quebec. Are you worried at all that there could be a second wave that comes in Montreal that's even worse than what we just saw?
But I think we're looking at our epidemiological situation, but we're also looking at what's happening in other countries that have 2 or 3 weeks ahead us. And of course, it is a scenario that we have to have in mind and to make sure that we are prepared. And at this time today, if we look at the conditions, I would say we're not ready for everything. All of those conditions, we're going to work on them. And what I see is that we have a possibility to adjust ourselves and to make sure that if everything is not there, maybe we're gonna modulate a little bit the way we deconfine or we reopen certain sectors for Montreal region.
Question maintenant de la part de Marion Scott de Gazette. Madame Scott, est-ce que vous êtes sur la ligne? So I'll ask the question for Madame Scott. Summer for Madame Valérie Plante. Summer in Montreal can be unbearable without swimming pools and wading pools to cool off, in parks to picnic in, a walk besides the old port, and the possibility of escaping into an air-conditioned public space. We have seen deaths of elderly and vulnerable residents in heat waves. What will the city do to help Montrealers to cool off while respecting guidelines to prevent contagion of COVID-19?
So it is a big challenge, because that could be every summer we face canicule. I'm not sure how to say that.
Heat wave.
Heat waves, yes. And so we need to think about that, and especially around not knowing about pools and our ability to bring a lot of people in air-conditioned spaces. So when I'm talking about the summer planning, it includes that as well. But I feel there might be also other requests, and we'll have to be creative on how we want to fight those heat waves and to offer some fresh places for people to cool down. So we're going to have to think outside of the box, and there might be also discussion with Quebec, depending of what will be the needs around that, because the city is not really prepared for this. But we will be prepared.
Et la deuxième question de Madame Marion Scott. What impact are you expecting the continued closing of restaurants, bars, entertainment venues, and festivals to have on Montreal's economy? And what measures are you planning to help tourism's, entertainment, and hospitality industries to survive?
So we will be sharing our inclusive economic recovery plan in May. So it's coming soon, and it's something we've been working with different partners, including the tourism area and the cultural area as well. So we will bring a lot of people together because we know how difficult it is for a lot of them, and for tourism, of course, it's huge. So I'm not able to give all the answers right now, but let's not forget that it will be also a way to work with the other level of governments, both Quebec and the provincial and federal, where they have more substantial sources of revenues to support those sectors that really need help. We're more there to accompany, to think creatively, to think of how we can do things differently for those sectors, but the need of the help of the other levels will be crucial.
Dernière question de la part de Gloria Enriquez de Global. Dr. Drouin, what's the criteria for testing and do you continue contact tracing?
At this time, the criteria for testing haven't changed, so we have the same criteria that the government gave us. There's, like I said, us people that are hospitalized, healthcare workers, all that we see in CHSLD, RPA, essential workers, and there is a specific priority that is at the discretion of the Directeur de Santé Publique. So at this time, that's why we're going to focus on some neighborhoods where we want to understand more if there is community transmission. But I think those criteria are going to change at a provincial level and a regional level in the couple of days or in the next weeks with the reopening to include the general population, because we will need to understand what is happening with this reopening.
Et la dernière question de Gloria Enriquez, is enough being done right now to help with shortages of staff in CHSLDs?
I think there's a lot that is being done. It is not my field of competency, but I think what I see, I think we have to ask the questions to the people that are working for the CHSLD. I'm sorry.
Thank you very much. Merci beaucoup tout le monde. C'est ce qui
Thank you, everyone. This puts an end to this press conference. We wish everyone a good day.
Tu mets ton masque, toi, là?
Habitué. Mais non.
Moi, je le mets quasiment pas. Je le fais quand je suis en vélo. Vous êtes le valeureux caméraman qu'on voit encore? Ben oui, c'est vrai. Je pense que t'es rendu le seul à ce temps-là.
Merci. Oui,